The Indian Express editorial reset and reform at the speed of 90 words per minute. Dictation start within 5 seconds. Start in his interaction with state chief ministers on Monday. Prime Minister Narendra Modi spoke about the need for ushering in reforms that touch the lives of citizens. Stop while details of the specific reforms the government intends to pursue of the possible roadmap are still to be spelled out. The ongoing crisis provides an opportunity for a conversation on re-evaluating the state's priority to area in particular deserve attention. First, the glaring inadequacy of the healthcare system in India, and second, the absence of safety nets for large section of the labor force, including migrant labor. They need to be addressed urgently. Stop public spending on healthcare in India continues to languish, falling well below levels in other countries which are at similar levels of income. Yet, over the years, there has been a tendency to favor an insurance based model, moving away from significantly expanding the public provision of healthcare facility. Stop this crisis is exposing the inadequacy and limit of that model. In the union budget of 2020-21, central government spending on health was pegged at 67,484 crore, or 2.1% of its total budgetary quality. Stop government spending on health at all levels needs to be significantly increased. Stop yet merely ramping up spending is unlikely to lead to the desired outcomes, as preferences for private alternative may dominate. Thus, spending plan will have to be reconfigured to ensure a commensurate rise in the quality of public healthcare facility. In addition to ensuring accountability for the service being offered, the focus has to shift to primary healthcare neglect, of which leads to a rise in overall healthcare cost down the line, as well as lowering health outcomes. The centralized model of healthcare spending also needs to be re examined, as this crisis has shown states have varying levels of institutional capacity, and going ahead, this need to be factored in. Stop the pandemic has also exposed the precarious living condition casual wage laborers, including the large migrant population, and their difficulties in accessing basic services dependent largely on daily wages. This section of the labor force does not have safety nets, and a drop in their income can push them into poverty. To address this is a social security architecture that is geared towards ensuring access to healthcare service, providing short-term relief for loss of income, and compensation for occupational hazard needs to be urgently considered. There is need to ensure portability of benefit, such as the provision of food through the public distribution system. The long term strategy should be to bring greater numbers into the formal workforce, which will provide them with some form of social security. The government could intensive the shift by founding part of the social security contribution as it has done through the Pradhan Mantri Rozgar Portion Yojana PMRPY, where it pay the full employee contribution towards their provident fund. Stop.